Hi everyone, I wanted to post a video update. For those of you that have been following my story, I went through the process of trying to get diagnosed with these symptoms that came on, more dramatically so at the age of 40. It seemed like it was a birthday present to me on my 40th birthday. But initially we thought it was neurologically oriented. We were looking at relapsing, remitting, or progressive multiple sclerosis due to my problems with mobility, leg weakness, changes in sensation, changes in balance, changes in vision and hearing. For all of those reasons, I had an abnormal CT scan of the head. They found some enlarged periventricular areas, which has also been seen in patients with MS. But when they looked for spinal lesions, they didn't see any. A family member was diagnosed with Ehlers Danlos hypermobility type at Stanford and suggested that I might have the same thing. And I said, no, I'm not double jointed. I've never been a contortionist. No, I don't dislocate my joints easily. In fact, I am tight, very tight. My muscles are painfully tight most of the time. But when I did further exploration, I actually did have a lot of the criteria for Ehlers Danlos syndrome. And what we've come to realize over the last year is the looser my joints are due to ligaments, which are connections between muscles and other structures. The looser my ligaments and tendons are due to this subpar collagen that's a genetic result, the tighter my muscles get because they are trying to stabilize what's essentially like a loose Jenga tower. My mobility issues are probably the most dramatic of my family. So as we've been going through this diagnosis process, other family members have been coming forward about similar issues that they've managed their entire lives. But I think my more dramatic issues with mobility are directly correlated to how athletic I've been and how much stress I've put on those joints. Since I've been diagnosed, I have IPT. I have eye physical therapy exercises that I do because I have convergence insufficiency. My eyes don't always line up correctly. And this was something I noticed around 40. I would take pictures and I'd say, hey, my eyes don't line up. And so I have exercises that I have to do to strengthen those muscles. My jaw, my teeth position, feels like it shifts a lot. I do have TMJ, and it is a known correlation with EDS. In fact, the Ehlers Danlos Society just uploaded a video with a physician speaker on Ehlers Danlos and TMJ. So for those of you who are interested, check out their YouTube channel. I haven't had a chance yet because I just went back to work. So I've been off for 8 weeks. I ruptured my ACL back in February. So initially they weren't going to reconstruct it because they said, well, normally there would be no point to reconstructing it. You're still pretty stable. But the orthopedist felt that in my case, because I already have mobility issues, trying to compensate for a ruptured ACL wouldn't help at all. So they did do the ACL reconstruction, but they didn't use my own ligament. They took a donor ligament because all of my collagen is bad. It took about 8 weeks. It didn't close. The surgical wound did not close until the end of the 8th week, which was a few days ago. And he said that was also attributable to the Ehlers Danlos syndrome because delayed wound healing and other post-surgical issues are complicated by the presence of Ehlers Danlos. They used some extra precautions with positioning me. They asked some extra questions about blood pressure. Ehlers Danlos people tend to also have some type of autonomic dysfunction. Your autonomic nervous system controls your blood pressure. basically your fight or flight response. So what happens when you get freaked out? You know, your vessels clamp down, you know, your bladder may alter, your digestive process is shut down. And so the autonomic system is involved in all of those. And so when we talk about autonomic dysfunction, those are also all the systems impacted by that dysfunction. One of the things I have noticed is that for the first time in like 10 years, I stopped doing my cardio exercises for pretty much stopped. I stopped lifting my weights. I do light weightlifting and cardio, and I stopped doing that. And what I noticed was interesting. I noticed my blood pressure started dropping. My systolic blood pressure, which is the top number, dropped as low as 89, 90. I've never seen it that low in my life. But my sister and my mother have very low blood pressure, which is not the norm, and it has been problematic for them. I also noticed more problems with dizziness, you know, when I was not exercising. So my theory, and this is just my theory, is that the more we're exercising, you know, that it keeps our blood circulating better. Our vessels are either maybe too stretchy, they're just that collagen just causes some type of issues with returning the blood. And so the longer we're on our feet, our blood pressure tends to drop. And that's known as POTS, postural orthostatic tachycardia. The longer you're upright, your heart rate goes up, your heart rate goes up to compensate for the lower blood pressure. Okay. Some people have this very severely. I don't seem to have it too severely, but I did notice this drop. That pattern of more extreme variability seems to be pretty consistent through other areas as well. So I have this nice little Fitbit, and it'll tell me my heart rate. So right now, let me see if I can get it on here. Right now, my heart rate, is 92. But for a significant portion of the day, my heart rate's over 100, which is technically tachycardia. I've asked it to tell me, to sum up how much time my heart rate spends between 100 and 120 every day. And it varies anywhere from 2 hours to 5 hours. The longer I'm standing, the more my heart rate is up in the higher range. And these are some of the things that contribute to the chronic fatigue that is part of Ehlers Danlos. The other part that contributes to the chronic fatigue associated with Ehlers Danlos is when your heart rate is variable, you also tend to cycle through sleep more. And sleep studies done on people with EDS show that they cycle up and down through the cycles much more often than people without EDS. And they have more periods of light sleep and wakening, and so they're not getting as much rest throughout the night. So that's another factor. From listening to the Ehlers Danlos Society lecture on autonomic dysfunction, you know, he said, for those of you that have ever been like, you getting ready, you head to bed, and then you lie there and you're like wide awake, like it's daytime, that's another component of it. So that's why I'm tired right now. I woke up at 2:30 and I was wide awake, and I was like, there's no way I'm getting back to sleep. So I just got up and I started my day early, and I'll probably end it a little early and come home and try to nap. So the other interesting thing that I've been diagnosed with is pelvic organ prolapse. Not that I want to sit here and give you my health history, because I don't, but organ prolapse is also, I mean, your organs are held up by ligaments, you know, and here again, apparently muscle strength is excellent, so ligaments are weakening. And so I have PT for that, which is very interesting. But basically, that therapist has said that I have a mixed presentation. I have a part of it where my symptoms are due to the ligaments weakening, and that's a physical issue. And there again, the trend in all my different PTs is there's nothing you can do about the ligaments weakening, but there is something you can do about strengthening the muscles associated with that weak ligament. So part of the therapy is aimed at that, and part of the therapy is aimed at the autonomic control of the bladder, you know, and just working with that component as well. So it's interesting for her, and it's interesting and helpful for me, because that, again, is another thing that has impacted the quality and the amount of sleep I get every night, which, you know, impacts your ability to function at work the next day. So what else? So that's the knee, that's the eye. So I have 3 different physical therapists. I can barely keep up with the exercises. My insurer did send me a walker. I haven't gotten the guts to use it yet at work. You know, but it feels really weird. We did a tour at this place the other day, and I was walking so slowly that the other little old ladies with the walkers were passing me by, you know, and I'm like, this is nuts. Like, I can't even keep up with them, like, when I'm tired. That's just crazy to me. But it seems to be pretty variable. I can walk into the room chipper and bouncing, and you know, by the end of the same day, I'm shuffling like a 90-year-old is the only way I know how to put it. So yeah, maybe I will, you know what I'll do is, I think on my next video to you, I will, I'll kind of review the appliances and the equipment that I've used to treat my symptoms, because I think whether you think you have MS or EDS, some of these symptoms may overlap. So you may find some of that equipment helpful, useful, or not. But it's been a couple years journey, so I've amassed quite a bit of equipment trying to self-treat, as those of you who are doing the same thing well know. So I'll leave it at that for now, and I will post again with a review of some of the equipment that has helped me for various symptoms. All right, thanks so much.